we are talking VBAC. I keep seeing a lot of posts in the mom groups where they're asking the question, how do I get a natural birth with a VBAC? Because I had a cesarean before. It wasn't fun. I didn't want the cesarean. I failed to progress, and I want to make sure that the same thing doesn't happen again. I really want to have a natural birth. So here's the thing. If you pay attention to what I'm going to be teaching you in this about 30-minute class, then you're going to avoid several things. You're going to avoid the fear that comes in planning a VBAC. You're going to avoid the bait and switch from your care provider. You are going to avoid the pain of a managed medical birth that is more traumatic than your C-section. You're also going to avoid an unnecessary repeat C-section, and you're also going to avoid getting tricked and falling into what I call the VBAC traps, the natural birth traps, the cesarean traps, the labor traps. You know what I'm talking about. I'm talking about those things that undermine your confidence, interfere with your body's natural physiological process, make you think that your body is broken and defective. It's not. And ultimately, you give up. You fight, you beg, you compromise, you give up on your dreams, you give up on what you really want, you crumble under the pressure, you give in to the interventions that you said you didn't want, all to try to avoid some trauma, but it's not that beautiful experience that you really deserve. And here's the thing. If you continue to pay attention to what I'm going to teach you, here's what you're going to get. You're going to get the roadmap to the birth that you always deserved. If you are planning a VBAC, then I know one thing, and that's this. You wanted a natural birth the first time, or you were talked out of it, or you were too scared to do it, or maybe your care provider pressured you and said, you know what, you have twins, you have a complication, we're going to automatically induce you. There is no trying a natural birth. And so you really were robbed from that experience, but you always deserved it. You always deserved it. You didn't deserve to go through birth trauma. You didn't deserve to have somebody else tell you what you were allowed to do. You didn't deserve that. You deserve to have that beautiful experience. You deserve to be welcomed into motherhood in a way where you got to witness your full power, because childbirth is really an initiation into motherhood. When the baby is born, the mother is reborn every single time. So if you follow what I'm going to be telling you today, which is the 5 things you need to know about planning a VBAC, then what you're going to get is you're going to have the actual roadmap that you need. You're going to avoid the traps that so many moms fall into when they're planning a VBAC. You're going to avoid getting the heavily medicalized version of the VBAC, and you're going to be able to avoid the bait and switch. Basically, you're going to get the birth you want without having to fight, beg, compromise. You won't give up. You won't give in. You won't crumble under the pressure. Nobody is going to be able to tell you you can't do it, because you're going to believe in yourself. All right. So before I get started, though, I just want to let you know, if you stay to the end, I have something for you, especially if you are under 26 weeks pregnant, but I'll tell you how to get that afterwards. Okay. So what are we talking about today? The 5 things you truly need to have a VBAC are the same things that you need if this is your first baby. There is actually no difference. The only difference between planning a VBAC that's hands-off and unassisted and being able to get that without having to fight, beg, or compromise, and planning your first birth without having to fight, beg, or compromise is this. There's a lot more fear placed on you if you've already had 1 or more cesareans. There's a lot more fear placed on you if you had an induction that didn't go the way you wanted. There's a lot more fear placed on you if you didn't manage to have that natural birth. And people are like, well, you couldn't do it the first time, so what makes you think you can do it this time? And now you've had a C-section. Now there's that fear of uterine rupture. So what's the real difference? As I said, it's all fear. The only difference is that there is more fear, more restrictions placed on you than if you were having a first baby. However, that's not actually true either, because the fears are still the same It's just that as a first-time mom, you've never done this before, so you don't know what to expect and you go into it blind. As a mom who's trying a VBAC, again, you don't know what to expect and you're going into this blind. And oftentimes you're falling into the same traps that a mom who's planning a first-time natural birth is falling into. However, this system still works whether you've had a C-section or not. Even if you had a previous natural birth, but it wasn't exactly what you were expecting, it was in the hospital, and maybe you're going for a home birth this time, this roadmap still works. So even if you are not trying a VBAC right now, this is still for you, because this system is based on what I did when I was planning my birth with my daughter. As you know, I had a disappointing first birth with my son. I had wanted a home birth. I got tricked out of it. I was fighting, begging, compromising. I gave up. I gave in. I crumbled under the pressure. And ultimately, I ended up with birth trauma. Even though I had a completely natural birth, I was still traumatized because my power was taken away from me and I made choices that I otherwise would not have made had I known what was really going on. Had I actually been able to pull back behind the curtain, ask the right questions, I would have stayed home. But if I'd done that, I wouldn't be here talking to you right now. I'd just be going, la, la, la. I had my awesome home birth. I'm happy. I had more home births. Birth is awesome. I don't know why everybody's complaining. And I wouldn't have seen what's really going on and what's really stopping you from having that completely hands-off experience. Because the truth is that when I got pregnant with my first, I didn't want anybody to touch me. I didn't even want to be in the hospital. I did those things only because I thought I had to. Once I learned that I didn't actually have to, that's when I got good and mad. And that's when I started teaching on this stuff. And with my home birth, I didn't do half the things that you're supposed to do with my home birth. I didn't even have any blood tests done because I already knew my blood type and I already knew what my status was. I didn't see any reason to check. Now, that might not be what you want to do, but the fact is that you can have your birth and your pregnancy any way you want. You do not have to follow the standard of care. However, when you are planning a VBAC, automatically the system tells you to follow the standard of care. And this is the same thing if you are planning a natural birth the first time around with your first baby, is that you think you have to follow the standard of care. And this leads into the labor traps, the induction traps, the VBAC traps, the natural birth traps, the cesarean traps, whatever you want to call them. These are all birth traps that lead to you having your confidence undermined. And it happens before you even hit 26 weeks. Here is what happens typically if you go in with the regular plan for VBAC. This is the typical way that moms do it. They decide they want a VBAC. They go to their care provider at their first appointment. They say, I'd like a VBAC. And the care provider pulls out the VBAC calculator. And then they tell them, well, you know, you have a 50% chance, or you have a 60% chance, or a 40% chance, or a 20% chance of this working. And they basically give you your number and they say, this is what we think. And if you happen to be in a practice that doesn't even believe in VBAC, they'll just automatically schedule your C-section. And then when you say, well, you know, I would really prefer a VBAC, they say, oh, no, we don't do that here. And you think you're not allowed and you stay with them and you think, I guess I have to plan a C-section. Or maybe you had a really traumatic induction the first time that led to a C-section. So you have no frame of reference of what labor is actually going to be like. So you're thinking, I don't even want to go through that pain again. So maybe I should just plan a C-section. So again, you've got this fear on you placed by the medical system, placed by our birth culture. And your doctor has now told you what your chances are of having a VBAC. If you're really determined, you may say, no, I'm still going to try to go for it. But now at some point, there's going to be restrictions placed on you. There's going to be the fact that you have to have your baby at a certain size. They're going to say that you have to have your baby by a certain date. They're going to schedule a C-section just in case. For more on that, though, you may want to check out some of my other videos on my YouTube channel, because I do talk about VBAC tolerant care providers. So what do you need to know? in order to plan and get the birth you want? Well, first of all, you have got to get a handle on your fears. That means you are going to have to write them out. And if you had a traumatic birth the last time, you may want to check out some of my other videos on, did your VBAC actually fail the first time? I do have those on my channel. There's some on getting past your fear. There are some on how to actually take those action steps and do the work to get past those fears. And I do have courses on this as well. But the best thing that I can tell you is this. Once you have figured out that your body actually works and that you did not fail, but the system failed you, your birth culture failed you, that's when you start to reclaim your power. Because the truth is that there are moms out there who had multiple C-sections and then they went on and had vaginal births at home or in the hospital, and they did them by themselves. There are moms who were told that they were high risk, and yet they still had a VBAC. There are moms out there who had twins in the car and it was a VBAC and they didn't expect it, but that's what happened. Because the truth is that your body is designed to birth. So the first thing you have to do is you have to get past your fear. You ready for number two? Number two, you need to also get the right education. This means educating yourself on the actual risk of uterine rupture. Don't go by what your doctor says, because oftentimes your doctor will exaggerate the numbers, especially if they don't want you to VBAC. If they don't trust birth, they are going to use those numbers to scare you. However, if you know that it is more likely that you are going to get struck by lightning or date a millionaire than have a uterine rupture using the physiological birth model, I'm just going to remind you of this part. You have to use the physiological birth model, otherwise the numbers are different. Then it's not that scary because you recognize that actually this is less likely to happen. The reason why VBAC stopped being a thing around the 90s is because when they were doing it, they were also inducing moms. They were also still speeding the labor up. Pitocin and Cytotec can cause uterine rupture even if you have never had a cesarean. So Pitocin is a dangerous, dangerous drug to be using for VBAC especially. It's something that you want to use as a tool in your toolbox if you really need it. But the way that it's being used in medicalized birth so constantly is why you end up with this high C-section rate, because babies go into distress with Pitocin. Labor is harder with Pitocin. It is not the same thing your body makes. It does not have the biofeedback. It does not signal from your uterus to your brain to say, this contraction needs to be slower. This one needs to be further apart. We need to really work with our body here. It doesn't do that. Instead, it's just squeeze, 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 one on top of the other, and just hyperstimulating your uterus. Cytotec does the same thing. And Cytotec is not even allowed in Canada, but it's still being used in the US. And I have read so many articles, so many books that talk about the dangers of Cytotec, but it's still being used to induce moms, and it's not supposed to be. So if your care provider is telling you, oh, we're going to induce you with Cytotec, big, big, huge red flag. You don't want to do that. You don't want to really be inducing at all unless there's complications, in which case some of my clients have even said, you know, I don't want to be induced again. I don't want to risk it. If my baby is actually in distress and we really do need to have this baby quickly, then I will plan a C-section. But I'm not going to go into my birth with the C-section as my plan. That's my backup plan. And this is how Jenny did it. She had chronic high blood pressure, gestational diabetes. She was an older mom of 41 years old. She'd had a previous C-section. She'd had a previous induction because of her high blood pressure and because she was already showing signs of preeclampsia with her first baby. And yet at the same time, she had a completely unassisted vaginal birth after cesarean in the hospital. And the reason she did that was because of this. This is what you want to do. You want to aim for the physiological birth model. That is your blueprint. Everything that you are doing in planning your birth is to aim for a hands-off, unassisted birth where you have medical backup somehow. Maybe it's you stay home, and if you feel that you need to call somebody to you, that's when you call them. You could have a completely unassisted home birth after cesarean like Rebecca did. Or you could say, you know what, I'd like to have a home birth, but I'm going to call the midwife in at the last minute. You've got a planned VBAC at home. Or you could do what my friend Christine did. I'm going to labor at home as long as possible, and I'm going to have a midwife so that if I decide that I'm going to actually stay home for this, the midwife can assist me rather than a paramedic who honestly, they don't know as much about physiological birth as a midwife. Midwife is still the gold standard for physiological birth. Or you could do what Jenny did. Jenny wanted to have her blood pressure monitored. She wanted to make sure that nothing would happen, even if she had an unassisted birth. So her model was different. Hers was, I'm going to labor at home as long as possible. When I can't stand it anymore, my doula and my partner and I will go to the hospital, but nobody is going to touch me. I'm going to labor as I need to. And then if I want the doctor to come in, then they can come in. If I want something done, then they can do it. But otherwise, I'm birthing this baby in the hospital unassisted. So she actually had her backup plan of being in the hospital. This is why I say you can have a VBAC even in the hospital, and it can be completely hands-off. You can actually do this. But if you're going to do this, you also need to know of number 3, which is the right environment. Do not go to a hospital that has a VBAC ban or an implied VBAC ban. What's the difference? A VBAC ban, basically the hospital says, we don't do VBAC. If you come in, you get a C-section. Now, a lot of advice out there says to just go in pushing, but that is not a VBAC plan. In fact, there was a blog post I read years and years ago that said go in pushing is not a VBAC plan. Because what happens when you do that is that your labor can stall and reverse itself if you get scared. That can happen even if you're at 9 centimeters. So the fact is that you come into that hostile environment where they do not want you to give birth vaginally. They want to push you into a C-section, and they absolutely will scare you and tell you that your baby's heart rate is going down, that your baby is in distress, that you are putting yourself at risk. They will find any little loophole that they can to get you in that operating room. They will do that. In fact, there have even been cases where doctors have pushed a mom into a C-section, and then they opened her up and they realized there was no baby in there because she birthed vaginally. So she just had major abdominal surgery for no reason. This is a problem. And then there's also the hospitals that have the implied VBAC ban. This is like one of the local hospitals that I had in my community that I warned Jenny to not go back to. And I said to her, look, I have heard stories, first-hand accounts from midwives. I can't name names and I can't say exactly who it was, but what I can say is this. A mom wanted to go in and have a vaginal birth after 2 previous C-sections. She'd hired this midwife supported her, but the hospital would not call the midwife in. Instead, what they did is they bullied this mom. They made this mom feel really bad about her choice. They made her scared. The baby had already been crowning, but they pushed that baby back up, and then they said C-section. And then they reprimanded the midwife for it because they're like, we told you we don't let you have VBAC after 2 C-sections. What are you doing? Why did you say your client could have this? So she got in trouble. The mom got another C-section. She was forced into having this, even though the baby was literally coming out, all because they just didn't want to do it. It was their policy. So again, you have to be very, very careful what environment that you're birthing in, which is why I tell all my clients who are planning a VBAC to plan a home birth. Yes, I understand that sometimes if you happen to be far away from a hospital, that's not ideal. This is why there's also the option of a hotel birth. There's the option of staying with a friend or family member who's closer, or you could even have an RV. You could rent an RV and park it across the street from the hospital. And then if you needed to, you could go. I mean, maybe you can't park the RV, but maybe you could park something else, maybe backseat of your car, or you just go to the hotel, or you do an Airbnb. Wherever you are, you can do this. Okay, this is something you can actually do. You do not have to go to the hospital just because you don't live close enough to a hospital. You can find a loophole. There are lots of moms who will travel great distances because their state does not allow VBAC, but they are not going to allow themselves to be forced into a C-section. This is tragic. This is absolutely tragic, which is why, again, I'm really for the unassisted hospital birth model, because with 99% of the population birthing in hospital, this would also allow for doctors to see that birth works, that they don't actually have to do anything, which leads to number 4, hiring the right care provider. You do not want to go with the VBAC tolerant care provider. They're no good. You do not want to go with anybody who thinks that birth has to be heavily managed and controlled. You need to go with someone who understands physiological birth. Now, this can be a doctor. This is more likely going to be a midwife, and it's going to have to be a midwife that is comfortable sitting on her hands and can actually work with you and tell you what loopholes you may need so that she doesn't get in trouble, you don't get in trouble, and birth is supported. So, I mean, it depends on where you live as well, which is why I also teach my clients how to take control of their pregnancy and to interview the right care providers and how to have those conversations with them when things don't seem to be working. Like Jenny had a doctor instead of a midwife. We could not find a midwife to support her. However, she was able to have those conversations. Rebecca went a completely different route. She knew she was going to have an unassisted home birth after cesarean, and her doctor was basically backup. Her doctor was not aware that she was going to do this. Rebecca only told her after. But the thing is that Rebecca's care provider very much was trying to push Rebecca into interventions and things that she expected Rebecca to do in the birth. But again, Rebecca knew she wasn't going to do any of that. And she was able to also have the conversation with her care provider to say, you know, I'm not doing this test, and have it be okay, and have her fears be released so that when she was able to have that discussion, she didn't crumble under the pressure, even though her care provider did try to convince her. I mean, this is what their job is. They have to tell you the risks. Otherwise, they feel that they're being negligent. However, oftentimes, the way that the medical system runs is that they think they are the experts and you are the one who needs to just comply. But that's not the way informed consent really works. Finally, the last one, you need to have the right support. This includes a doula, this includes your coaches, this includes your childbirth educators, your friends, the mom groups that you hang out in, all are going to contribute to your mindset. Remember when I said at the beginning that you need to be able to get past your fear? Well, the people that you hang around with the most are the ones who influence your mindset. This is true in life. So if you're trying to become a high-level person, you do not hang out with low-level people. If you're trying to build a business, you don't hang out with people who've never had a business. If you are trying to get fit, you don't hang out with people who have never even heard the words clean eating and exercise. If you're trying to have a VBAC, you do not hang out with people who are afraid of physiological birth. It's that simple. If you are in mom groups where there's a lot of fear and a lot of people telling you VBAC is dangerous and a lot of people telling you about uterine rupture and a lot of people telling you about pain and about complications, you need to get out of those groups or at least mute them, because you need to be in a supportive environment. That's what the empowered birth community is. It is a supportive environment. And I build that inside my programs as well and for my coaching clients. And I am part of that supportive environment for them. so that they always have me to cheer them on whenever they're feeling like nobody else is believing in them. They have me to believe in them. And that's really how Rebecca and Jenny were able to do it, is because they had that right support. They had the 5 pillars. That's what these are. These are the 5 pillars of empowered birth. They work whether it's your first baby or your 4th baby, or you've had a traumatic birth, if you've had inductions, if you've had vaginal births that didn't go the way you wanted, if you've had multiple cesareans. These pillars work no matter what. They are the right mindset, the right education, the right environment, the right facilitators, and the right support. When you have all 5 of these optimized, that's when birth starts to work. That's when you create your plan. So you want to know what your VBAC plan is? I'm telling you right now, your plan is get past any fear and trauma that you have and release the idea that your body is broken and defective. That is not going to serve you. As long as you keep believing that your body is broken and defective, it does not matter how much education you try to put in your head. You are going to have those beliefs in the back of your head that you're going to be that scary 1% or 0.1%. You're going to be that person who says, yeah, I know other people can do this, but I can't. No matter how much education you try to pour through, no matter how many classes you take, how many books, how much preparation you do, if you do not get past those fears, it is not going to work. If you do not shift your mindset like Jenny did and what Rebecca did, it's not going to work. You have to have that right mindset first. That's why that's pillar number 1, not pillar number 2. Pillar number 2 enhances pillar number 1. The next one, you have to have that right environment, because it does not matter how much education you have, and it doesn't matter how fearless you are. If you're in a wrong environment where they are basically going to force you into a C-section no matter what, like one of the care providers in the States who'd said to Renat Dre, patient has decisional capacity. I have overridden it and I've chosen to give her a C-section. Like, this hospital was obviously not helpful, because if it had been a good environment, the nurses and other doctors in that hospital would have taken one look at that OB and said, you are violating her rights. You can't do that. But nobody stood up for her. Why? Because that was a toxic environment. And when you're in that toxic environment, it's called horizontal violence. By the way, this is the term that they use. It's called horizontal violence. It means that your colleagues are all against you when it comes to supporting physiological birth. So it doesn't matter how good your care provider is. If you choose a hospital where they're going to basically be scrutinized and they're going to be reprimanded, and the nurses are going to be like hovering the whole time and putting all that pressure and fear, it's not going to work. You might even still get your VBAC, but you're going to have to fight, beg, compromise. You might give in to some things. You might give up on other things. You might crumble under the pressure completely and have a C-section. It's just the way that this is. I'm sorry to say it, but that's the way it is with this environment. So you really have to know, not only is this safe for me in terms of, do I feel safe birthing here, but also recognizing the political aspects of this, because not all hospitals have the high C-section rates. So when you look at that, you have a similar population, but some hospitals have a higher C-section rate than others. You can sort of figure that out. And you also need to recognize what the culture is like there. The best way to do this is to ask local doulas who have actually helped their clients in similar births than what you're looking for. You don't even have to hire that particular doula, but get their expertise on it, because we will tell you. We will tell you. But if you're already set on birthing at that hospital and say, you know, I've chosen to birth at this hospital, we kind of wince. And at the same time, we have to respect your choice, and we can't influence you too much. We don't want to scare you. But if you're doing your research at the beginning of your pregnancy before 26 weeks, we've got time to switch that around. If you're already 37 weeks and you're saying, oh, I'm birthing at this hospital, we know it's going to be a hell of a lot harder to convince you not to go there than it would be at the beginning of your pregnancy. So This is if you're planning the hospital route, which again, I say should be still the last resort. And if you're going to do that, go in at the last possible minute. Because if you're going in at the last possible minute, they have less time to pressure you into things. And if you're going in at the last possible minute, you're able to show them that physiological birth works, which is the whole point. If you're going to the hospital, it's physiological birth, hands off, maybe call in some support that's just right there if you need it. But otherwise, VBAC is just your body doing what it's designed to do. Of course, if you're going to have the right care provider, that even helps more. Because when you have the good environment and you have the right care provider who knows how to sit on their hands, then you know that they're not going to push anything unless you truly feel that you need it. They're not going to push anything at all. They know their role. You've been able to communicate with them the entire pregnancy to tell them their role. Their role is to support you. Their role is they have certain skills, they have certain knowledge that if you want to have it, then you can ask for it. But they are not there to dictate. They're not there to plan your birth. You are there to plan your birth. You plan your birth. You bring in the people that you want. And this comes again to the right support. When you have the right support around you, then if your care provider starts to say things that make you uncomfortable, you have people around you that can say, okay, but what are you really looking for? Because you're telling me your doctor's saying this, and I'm not going to tell you to just do what your doctor says. I'm not going to tell you that. You already got that speech and you don't need it from me. What you need is support and love. And you need to be able to know that you can do this. You need to be reminded of everything that you might have forgotten in that moment because you're scared. You need somebody to ground you and help you so that you can take a deep breath. You can think about what you really want. You can bounce those ideas off of them. They can support you. And then you go and do it. Because the truth is your support team cannot birth for you. Your care provider cannot birth for you. Your doula cannot birth for you. The only one who is going to be able to birth this baby is you. You're the only one who's going to have this experience, this unique, powerful experience, and you deserve to have it your way. All right, so that's all I have for you today. And I did also promise you something else. So here's the thing. When most moms are planning their births, they're waiting until the very last months of pregnancy. I've told you in other videos that this is not what you want to do. In fact, I figured out the system after I had my son, because the first time I got pregnant, I started planning right away. I knew exactly what I wanted. I wanted a home birth. I didn't want any interventions, and I planned it out because I'm a planner. This is what I do. I plan things months in advance. I will plan my taxes months in advance. I will gather information long before I actually make the move to do it because I want to be as prepared as possible. This is also how I'm able to run my life as a single mother because, trust me, things will fall apart if you don't plan ahead. If you don't have that plan in place, you don't know where you're going, you can't find the pitfalls, you can't see the possible challenges that may come up, you can't come up with a backup plan for those challenges. And then when those challenges hit, you don't know what to do because you didn't think ahead, right? So if you're thinking to yourself, oh, I'm just going to get a midwife, but then suddenly you find out that there's no midwives available, well, now you have to pivot. But a lot of moms, they think, oh, I'm just going to get a midwife and I'm going to get a doula and everything's going to be fine. And I don't have to think about this right now because I'm only in the first trimester. This is exactly why you need to think about this in the first trimester or even before you get pregnant. The truth is that you don't see your care provider typically until about 10 weeks. Maybe you go for a battery of tests or maybe you don't. Maybe you choose not to do the tests. But the fact is that they don't see you in typical prenatal appointments until 10 weeks. This is what my midwife told me. And I ended up doing all the interviews in the 10-week time period. I did it all in 1 week. I did 4 interviews and one of them didn't go through because they just were like, I'm sorry, our practice is full. We can't take you on. So I had 3 intake forms, 3 different interviews. I knew all the midwife practices and I did them all in the span of a week. And you can do the same thing. You can interview all the practices in the first few weeks. You can have your map Then after that, you start applying to the practices, and then you go for the interviews and you find who's the best fit. But you already have your plan. Nobody is going to tell you what you can and can't do. This is the difference. This is why you need to be thinking smarter than what you've been taught. Okay? So it is not, I'm pregnant, I got to find a doctor. It is, I'm pregnant, I'm going to create my birth vision, and then I'm going to find the people to support me. And maybe you even come to the conclusion that you don't even want a care provider. I mean, hey, if you choose to have a wild pregnancy, I'm not going to hold that against you, because this is your birth and you deserve to have whatever kind of birth you want. But the fact is, you won't know any of this until you have your roadmap. So that's what leads me to the next thing. Right now on my website, I have created 2 new guides. One is my natural birth traps guide, but I've also included another one now. 26 things that you need to know before you hit 26 weeks. It's called your Empowered Birth Blueprint. You can get these 2 guides very simply by going to empoweringmomsbirth.com, right on the homepage, scrolling down where it says, are you trying to plan a natural birth or first time planning a natural birth? And then put your name and your email in, and that will get you those 2 guides delivered to your inbox. You're also going to get a sequence of other emails delivered to you over the next few days that will give you everything else you need to know in the first trimester for optimizing your chances of having a natural birth. The completely natural, hands-off birth where you're not fighting, begging, compromising, you're not giving up, you're not giving in to the pressure, you're releasing your fears, the whole thing. You're going to have the whole thing. And if you want to know more about creating your birth plans, you can always just send me a message, Carly@empoweringmomsbirth.com, or send me a message in the Facebook group. I'm always happy to answer questions. I'm always happy to help you plan and get the birth you want, because honestly, there's so much information out there, and I'm shaking my head because I know that that's not all you need. I know that you need this roadmap. So again, if you want it, you're going to be able to get it very simply. Just go to my website, empoweringmomsbirth.com, and then you just put your name and email in, sign up for the newsletter. You're going to get 2 guides. You're going to get the 20 traps to avoid when planning a natural birth. And you're also going to get 26 things you need to know before you hit 26 weeks, so that you have everything that you need to plan and get the birth you want without fighting, begging, compromising, and you're not going to crumble under the pressure. You're not going to hire those care providers that bait and switch you. And if you're planning a VBAC, this is even more important, because there's so many VBAC tolerant care providers out there. And I just keep seeing this over and over. And I am committed to making 2023 the year of empowered birth. All right. So I will see you soon. Talk to you soon.